Assalamu alaikum and peace be upon all of you. My name is Sufyan Farouk and I manage the programs at Wasa Institute, an organization that focuses on the intersection of health and spirituality. You are all joining us here today to discuss a very important topic and very relevant topic, cancer recovery through spirituality. And we are joined today with three esteemed panelists, the first being Mr. Neil Colhorst, the CEO of CanCare Atlanta, a faith-based organization that provides support and compassion for cancer patients. He's also an associate pastor at Johns Creek Presbyterian Church and the director of Johns Creek Presbyterian Church Counseling Center. He's a clinical member of the American Association of Marriage and Family Therapists, and since 2013, Neil has been a certified CanCare trainer. Another panelist is Imam Mahat Gamer. He was raised in Houston, Texas, and he's the founder of Sohba Institute. He attained a bachelor's in Islamic law and jurisprudence from the International Islamic University of Malaysia and is completing his internship for his master's in pastoral counseling and marriage and family therapy. Mahad and his wife Safiya were the co-founders of Sohba Institute, and through Sohba, they offer online and on-site Islamic studies courses for adults. And they also offer marriage-related educational programs and events for singles, engaged, and married couples. And last but not least, we have Dr. Bassem Hamid. He is the founder of Wasa Institute, the organization that focuses on intersection of health and spirituality. He is also a neurologist and an imam for Shadow Creek Islamic Center and is a member of the Clinton Foundation, working on the opioid health crisis. And something that I'd love to mention is that he was recently honored by the Clinton Foundation and their virtual benefit event for all the work that he has done for the national opioid health crisis. So definitely big congratulations for that. Welcome, everyone, and thank you for joining us today.
Thank you for having me.
Yes. So the first thing I just to start off this conversation is ask every single one of y'all, why this topic in specific, cancer recovery through spirituality, is important to you. I'd love to start with Mr. Neil Colhorst.
Well, a couple reasons it's important to me. If we think statistically, in our country, 1 in 2 males and 1 in 3 females will be cancer patients at some time in their life, which means when you do the math, everybody in our country's lives will be touched by cancer. So this is not something that, somebody over here has cancer. I hope it doesn't affect me. The answer really is, well, if it hasn't affected you now, it will. And if that's your friend, it's already affecting you. So this is a topic that used to be taboo. We didn't want to talk about it. People used to believe, actually, if you talked about it, you'd get it, which is bizarre, right? But this is something now that with the advances in medicine, that more than likely cancer patients will not be dying as much as they will be managing their cancer and living their lives. So this is a topic that we all should be able to put out in front and learn to talk about openly.
Definitely. I definitely agree with you. Something that we need to shed light on. Imam Mahad?
Bismillah. So thank you for having me. Why this is so pertinent, obviously as an imam, I'm called in to various, community members who are going through this themselves. And myself, I've had family members who I've lost to cancer, and may God have mercy on them. And had individuals and friends, but I actually got my diagnosis a little over a year ago. So myself, I had gone through chemo and radiation, and just going through that experience and being able to go through it firsthand and meet cancer patients in the ward together and talking to the chemo nurses, I think that the perspective I have is that of a patient who's gone through it, not just of the imam who is there at the bedside to comfort the family, but also what that trial looks like from the inside and what that struggle can look like for the family as well. So that's why it's something that personally, as I was mentioning in the pre-discussion before we went live, it's something that even till today, like when I mention it, sometimes it'll still bring up those emotions that are very raw sometimes, right? It'll be very painful to think about those treatments, those countless days and nights in the hospital. So it is something that is very close to me.
Thank you for sharing that. I really appreciate it. Dr. Hamid?
Well, I'm a doctor, and at one point in my career, actually, I had the privilege of working at MD Anderson Cancer Center, which is, one of the, or we say in Houston, the best cancer center in the world. And I work with the pain service, so we had to deal with one of the most important aspects of cancer care. That's their suffering, their symptoms, their pain. And I experienced actually cancer in a family member. My older sister, my beloved sister, actually had advanced breast cancer, and she died a couple of years ago. And I had experienced actually the stages that she went through from diagnosis, then surgery, chemotherapy, radiation, and dealing with the side effects, dealing with the family issues, dealing with every single aspect of her life. And like Neil has mentioned, now cancer patients, what we call it, live in a chronic state. Actually, they have cancer is viewed in light of advancement of treatments, is viewed as a chronic disease. So unlike in the olden days, you get cancer, you have to count your days and die. Now luckily the patient is living through it, but with that comes a lot of changes and a lot of issues that you have to deal with it spiritually, emotionally, socially, economically. And to me, as a doctor and as imam, I have to deal with that, whether with a patient or with a family member or with a community member.
Definitely, absolutely. Just another way to kick off this discussion, I would want to talk about a few stats that I found on the National Cancer Institute. One thing that was mind blowing to me, and Mr. Cohorst actually mentioned it as well, how relevant cancer is in today's society. In 2020 alone, an estimated 1,800,000 new cases of cancer will be diagnosed just in America, and around 600,000 will pass away from this disease. I think these are staggering numbers, and that tells you right away that cancer is such a relevant thing, and maybe if you don't have it, you know someone who does have it. And the rates of new cases of cancer is 442 per 100,000 men and women per year, and this is on a case from 2013 2017. So to talk about the few questions that we had for this discussion, the first one being, what role does spirituality play, and what effect does it have on cancer patients in the process, positively or negatively? And again, it's an open discussion, so anybody can take hold of this question.
Well, I'll jump in, and then the next question, if somebody else will start, then we'll kind of go around that way.
Like that.
When I think about spirituality, I think about things like peace and hope and love and meaning. But when I think about especially human beings and their spirituality, irregardless of what kind of culture we come from, human beings have a need to belong. They have a need to have a sense of identity that's coherent and makes sense to them. And they have a need to have purpose in life. I call it a BIP, a BIP. And when you get a cancer diagnosis, immediately your sense of where I belong gets, shattered in some ways. As we were talking earlier, you hear that you have cancer and you feel like a stranger in your own land. You're walking and does anybody really know what's going on with me? Your sense of identity goes from, hey, I was just living my life to I'm a cancer patient. And now because of the way your life is scheduled and setting up your MRIs, your scans, you're getting pricked all the time, that sort of thing. Your identity, you become a patient, which isn't who you are. And then how do I belong is really, I'll call it up for grabs. And so there's a spiritual distress or distresses that occur in us when we have a sense of not knowing where we belong, who we are, and what our purpose is. And within the cancer community, and Dr. Hamid can really speak to this as well as Iman, it's really important to have your medical team and your church team, your faith community, your mosque that's really supporting you and saying you're one of us. And an organization like CanCare, when we train cancer survivors to provide care to cancer patients, it's an immediate identification that now you are one of us. You belong in our community. And we train people of all faiths and backgrounds to be care volunteers. And so now you're not just walking lost like a ghost in the land of the living while you're still alive. There's actually people that you can identify with, that you have a sense of belonging. And as you're going through your treatment, and our imam can talk to this, as you begin to share your journey with others, that brings you a new purpose in life. And this is all part of a spiritual need and a healing that can take place for cancer patients and their caregivers.
Certainly. Go ahead.
So I was just going to share that I remember, just to give a little bit of background, I actually had a spinal cord tumor. So when they removed it, they found that it was cancerous, but when they removed it, obviously messing with the spinal cord, it left me with a lot of mobility and sensory issues. So I was in a rehab hospital, Tier Memorial Herman, which they're a wonderful facility over here. I was there for about 2 weeks. And regardless if I was in the cancer hospital getting chemo and radiation, or if I was in the rehab hospital, any conversation with fellow patients I'd have, almost always, when you talk to them for a meaningful period of time, the conversation would almost always lead back to God at some point or another, right? It would always go down that route. And it's like, and you would assume, as an outsider maybe looking in, it would be a conversation of discontentment, of being displeased, of saying, why me? But almost always when they're bringing God up, they're talking about gratitude for what they have. And even though they're going through this, God is going to help them get through this difficult circumstance. And I say that's one of the crucial roles of spirituality. Is spirituality and connecting with God and having a relationship with Him is not a means of avoiding calamities and difficulties and financial challenges and relationship issues. Rather, it's one of the best coping mechanisms and tools that we have as human beings, opposed to seeing it as some kind of like magical spell that, oh, if I'm close with God, if I'm connected to God, I'm bulletproof now, I'm good to go, right? Which is in opposition to when we look at the great prophets of God. They were all challenged and tested in various ways, and their families as well. So I think that spirituality is it's a natural thing that many people, especially when they get this diagnosis or they hear the word cancer, you just like when I heard the words first time, we found cancer, like everything else kind of like you know the scene in the movies when the like a blast happens and everyone's shell shocked, and whatever's coming out of the person's mouth is like, you're saying words, but I'm not hearing anything. I'm in a different state right now. And that's what happens. And many people, because of that, they actually find a closeness to God. So I think spirituality is deeply connected when it comes to looking at your own mortality, when it comes to looking at your own existence and your purpose over here.
Yes. So Mr. Colhurst and Imam Mahad both beautifully put it in nice words. And I can tell you as a doctor, when I make the diagnosis or see a patient with cancer, I have actually that kind of shocking feeling, honestly. And, you know, it leaves me with mixed emotions. And of course, as a doctor, you have always to balance between the medical practice and the social aspect and the emotional aspect of the practice. But I can tell you that for many people, this moment of diagnosis is a moment of awakening, actually. And here you have a lot of people that go on a track of either negative spirituality, what I like to call, or positive spirituality. One people is like what Imam Mahad would say, why me? So they would have these negative emotions, negative spirituality, I call it, like the remorse, the feeling of retaliation, that God is retaliating against me, or basically what they call also in psychology negotiations, like try to negotiate with God. Well, if you do this for me, if you cure me, then I'm going to be a better person. I'm going to do this or that. And it is very important to identify these emotions and transfer them or replace them by positive emotions, by positive spiritual aspects. Number one was what Mr. Polhurst like nicely put, finding purpose in life. You know this is a serious diagnosis, and you should have priorities in life. For someone who hasn't really lived life the way it should be lived, this is a wake-up call where you have to live it for a purpose, to belong to something bigger, and to redefine your character based on this new development. The second thing is finding hope, that you're not alone in this. And the grace of God is bigger than anything else, and bigger than doctors, bigger than medications, and bigger than the diagnosis of cancer itself. And yes, this is a very consoling and peace giving effect, actually. The other aspect of this positive spirituality is finding that connectiveness, connection to God, returning to Him. And, whether you're living or whether you're dying, it doesn't matter so long you're in that nearness to God, because in His glory, in His mercy, in His grace, you're going to live. And that is certainly more valuable than the temporary life you're going through.
Definitely. I mean, those are things that even I didn't even know myself. Because I mean, those are just great ideas that y'all brought in. Because I mean, I definitely believe in myself. When people do, because I had a cousin recently, who did have cancer, and she told me that she said, "Why me as well?" And I think that's just a relevant thing that happens to a lot of people. So definitely, I feel like having the idea of spirituality does bring comfort to a cancer patient. So the second question is, as the prognosis of a patient changes, throughout the treatment and recovery, this is towards Imam Mahad, but of course, Dr. Hamid and Mr. Course, I know you have experience with your relatives having cancer as well. Have you observed any impact on their spirituality throughout the entire process?
Yeah, it's a very, very relevant question, because that is, you might get a certain diagnosis, you might get a certain course of action the doctors present to you. And just because that is presented to you doesn't mean that's definitely going to be the case, right? We know things can change for the better or the worse. So I think even, looking at the title Imam over there, obviously the assumption of the viewer is, oh, you were an Imam who had cancer. That means you were like set, right? You're good to go. You were spiritually connected with God. Everything was great. But we're human beings at the end of the day. Regardless of who we are and regardless of our faith and our background, faith is something that is not just stagnant and stays the same throughout our lives. It's something that's constantly a journey of up and downs. And I remember there were times when, and especially because of the medications I was on from the surgeries and various things, they would have so much of a heavy effect on my mind, my ability to cognitively think and approach ideas, my ability to focus. I remember when I was after surgery, I was on heavy medication for muscle spasms and back pains, as well as like nerve pain medication, which just completely just threw out any semblance of having rational thoughts and logical ideas, being able to put them together, put sentences together. It was out of the window. So for me to be able to even communicate with God in a way where I felt like I even knew what I was saying or doing, I felt like there was a stint of time for maybe 6 months where I wasn't really myself. So some of the medications, the treatment, just the emotional effects that happens on you, it's going to have an effect and impact on you. Whether things are getting better or worse, it will definitely have it. And even some of the most challenging times, some of the darkest times, I would say, in my life had been those moments where I'm in the hospital room by myself, and my mom or my dad or my wife is there. It's the middle of the night, and I'm just like hooked up to different things, and there's medication going into me, and I'm feeling absolutely nauseous. It's just like you're physically getting just getting broken down, as well as mentally. So it can become very difficult at certain times to be able to pray. But at other times, literally in the same hospital stint, in a matter of hours, it flips. And you're calling out to God desperately, and you're praying to Him, you're pleading to Him. Some of the best prayers I ever had in my life, and the best connection I ever had, was during this time. And some of the worst ones were also this time as well. So I think that's a testament to the ups and downs you'll have. So it's just human nature that we're going to have these influx of emotions, especially with just such a traumatic event happening in our lives. Just it's natural to have these ups and downs.
Yeah, certainly. As the cancer patient advances through this journey, through the course of this disease, they're going to have a lot of needs, the treatment, the support. But what shouldn't be overlooked is their spiritual need, actually, because just like Imam Mahdi explained, you go through some of the worst and best, actually, times of your life. And it is very important to be aware of these needs and address them. Because, as we mentioned, by nature, a lot of people are going to be positive, some people are going to be negative. And again, we need to reframe the thinking, the thought process, and replace the negative emotions by positive emotions. Being a neurologist, I have to throw in something medical basically. We have seen evident actually on imaging, functional MRIs, and other studies, the positive effect of spirituality on the brain. And that is being a very important factor on how to cope with anxiety, with depression, with the states that you can develop while you're in cancer. I mean, when you're in cancer, you're going to be depressed, you're going to be having low mood, like anxious, rightfully so. And the importance of spirituality comes actually. And the worse the diagnosis is, then the more need there is to spirituality. And that is again evident on how it changes the chemistry and the physiology in your brain and transform it into a positive one.
Yeah, I love hearing that because that's something that's been of interest to mine for the last 20 years. When try to integrate with both of what you fellas have talked about is that with faith, faith is oftentimes folks think of faith as a possession. If I have this, then I'm bulletproof, as Aman says, right? And as we live life, we realize that's a childish way of thinking about life. Life happens, and faith is what we experience, what we live with and through, and learn how to trust through all the ups and downs in life. And so in our prayer life, sometimes we can feel like we're really fluid and we can have these beautiful prayers. We think that's faith. Other times we don't even know how to say a word and all we have is a deep groan. Well, believe it or not, that is also faith.
Absolutely.
And that is oftentimes one of the deepest forms of prayer is a deep sigh, is entering into anguish. I can tell you personally in my life, I was a caregiver to my wife who's a colon cancer survivor. And then I've lost numerous family members to cancer and had other losses in my life. But there are certain times in life as a human being when you allow yourself to drop into a deeper form of anguish. And this is the place where we call lamentation, where all is not well with my soul. My heart is poured out like wax. My bones feel like they're out of joint, is what the psalmist says. I can't even pray. It's just the Spirit praying in utterances too deep for words for me. And oftentimes when we go into that place of deepest anguish, where we think I've lost my faith, many people say that's when they felt most alive. That there's something that happens in that place that you can't replicate. You have to go there. But when you go there and you come back out, you are transformed. So we have to allow ourselves to be open to this groaning faith, this lamentation that happens. As well as we know with the functional MRIs, when people learn how to focus on a certain prayer, a word like peace, or my studies early in my career where I'd ask people, what brings you comfort when you're experiencing a trial like this? And when folks are able to think about that word or that time, their autonomic nervous system relaxes and they activate a different part in their brain. At times, the parietal lobe dampens and they get a sense of they're out of time and space. They're in this ubiquitous place with God. And it's there that there's oftentimes then a sense of what we would call enlightenment, or I have a sense of peace, I'm going to come through this. So whether we're being able to calm ourselves and enlightening ourselves, or going now and then into anguish and feeling a different type of being alive, all of this is about our spiritual care And it speaks to what I think you all have been saying in your own way, is God is present in all those experiences.
Absolutely, absolutely. And I'm really glad that you all mentioned, especially one thing that I think we should definitely shed light on is the fact that, spirituality and your relationship with God is something that's fluctuating. As Mr. Cohort said, it's not something that you possess. Whatever trials or tribulations that anyone goes through, it can't expect your relationship with God to be the exact same and constant throughout your entire life. Like things and difficulties will come your way and that will fluctuate your relationship with God, but it's not a bad thing. It's us being human. So I think that's one thing that people need to realize. Don't ever feel like, just because you're not able to speak to God in a more fluid way, it doesn't mean it's tarnished. It's just a different version of how your relationship with God.
And I want to speak to that for a moment too, the importance that it's not only our faith and our belief, but it's a communal faith and belief to be tied in together. And I won't go into great detail, but I was going through an awful period, and I'm a Presbyterian minister, right? And I'm not supposed to have awful periods, but I was awful loss. And I was with my colleagues, and I turned to one of my colleagues one time and I said, I just don't think I can believe anymore. Wow. And the greatest words I ever heard in my life up to that point were these: that's okay, Neil. We'll believe for you until you can believe again.
Wow.
And that's the power of community and communal faith.
That's amazing.
Yeah.
I mean, that thing that even goes back to what CanCare, what they focused on is bringing communities and having someone to give you that support, especially when times when you feel like you don't believe. So that goes to show that CanCare is doing some great things, and their initiative is absolutely amazing for CanCare patients. So on that topic, I think this is kind of towards Mr. Cohorst, and of course Imam Mahad and Dr. Hamid can pitch in. So what is the status of spirituality when it comes into the cancer care currently?
That's a great question. I'll answer it in two different ways. One is with CanCare. One of the things that we truly believe is that when you go on a journey, it's really important to go on. If you're going to climb a mountain, it's really important to have somebody who's already climbed that mountain go with you, right? And this is what's really important. Is in our training of cancer survivors and caregivers, we really emphasize meet the person where they're at, because where they're at's where they need to be at. They'll move in their own time and way, and oftentimes they'll be oscillating back and forth. But meet them where they're at, and in that way, then you can listen to. Yeah, okay, is your faith helping you today? Yes. Okay, how is it helping you? Or is this a hard day? What can help? Is there something in your faith or in your community practices that can help you? So that rather than think we got to go in and fix, we meet them where they're at and then work to support the resources that they have, even when they feel slim inside. The other is that Dr. Hamid may be familiar with this. There's a study done in Indiana a few years ago called the OASIS study. And what they did is basically they looked at, within medicine, there's been this uneasiness with religious spirituality and faith practices for a long time. It's changing now. And this study has really helped, because the fear was, well, what if a physician asks the patient about their faith? Is that going to do them harm? And what happened with the OASIS study is the exact opposite. They found that it actually helped calm the patients and actually helped strengthen the relationship between the physician and the patient, and their level of the person who was asked these questions about their faith, at least for a short period of time, their sense of anxiety and depression lessened, which we believe is helpful in the healing process. So I think that the from a medical standpoint, and then from organizations like CanCare, we really believe that the person's spirituality is important. And for CanCare, one of the underlying principles and foundations has always been this: all healing comes from God. All healing comes from God. we're called to be sojourners along with folks on their journey. And that's how God uses us in the healing process.
Absolutely. That's very profound, Mr. Cohort. It's very moving what you said. And I just want to reiterate a couple of points that faith, spirituality is not a static state, actually. It is dynamic, it's a fluid, and it can increase and decrease. And this is one of our actual fundamental beliefs, the change of the state of faith. And one of the things that we believe changes faith and increases is what we've listened to earlier, prayers, rituals, whether you do it or someone else is doing it. And that is, by the way, it is not a matter of belief or faith. It is actually what we've heard. You see it on the MRI, actually. You know, you see certain sites on the MRI lighten up when someone focuses on a word, mantra, for example. You know, whether it's peace or Allah or Subhanallah. This is some of the mantra words that we use in our faith. Or when you're in an environment where you're listening to scriptures or to prayers from someone else, or just being in the company of someone else, actually. So this is why the pastoral care, the spiritual care, has become an essential part of taking care of patients in general, but cancer patients in particular.
Mama, do you want to add anything to that?
I think the only thing I could add to it is, as both panelists, they mentioned the need for having someone alongside, right? When not climbing that mountain by yourself, when you've never been through this terrain before, right? Having someone who can lead you through that. I can speak to that in a realm where it was a bit more visual for people to see. Obviously, when I was going through chemotherapy and I lost all the hair, and also on top of that, I had just had the spinal cord surgery, so I was in a wheelchair for about, a good 3 to 4 months. And then I moved to a walker, and now I'm kind of using a cane and doing physical therapy. But when I was in that situation where all the hair was gone, in a wheelchair, I really did not like going out and seeing very many people. Because even as I was preparing for this and getting ready to speak, I told a friend, and they said, well, why do you feel comfortable talking about it with us or with other cancer patients, but not anybody else from the outside, right? And they said, is it because of the eyes? And I said, what do you mean the eyes? And as soon as they did it, and I was like, yep, it's because of the eyes. Is it because of this? Oh, are you okay? Are you all right? What happened to you? As soon as they give you that, as soon as somebody who has not experienced what you have experienced,
that's right.
It's like a ton of bricks. And that pity can be, imagine that happens once, happens twice, 3 times, in a single evening that you go out anywhere you go, anyone you interact with, they haven't seen you in this state, and exactly what Mr. Kolosh was saying about being a stranger in your own environment. For many people, they might not understand that until maybe they get this full image of you being the same you, but now you look different, or something has changed about you, your diagnosis is different, and now everybody else is treating you in a manner very different, opposed to what I was earlier as well. So when I'd be in a wheelchair and somebody would ask me, what happened, I would hate going through the conversation. But if I saw anybody else in a wheelchair, or if I saw somebody with crutches, we would lighten up with a huge smile on our faces. Doesn't matter how old they were, man, young, old, doesn't matter race, religion, anything. And one of the first things we talk about is what the wheelchair situation. Yeah. Opposed to anybody else asking me that question, I was like, I do not want to go over this again and again and again. If it was somebody who has gone through something similar, the way you can relate, right? I don't know if the right term is misery likes company, but it's the notion of when you're in a difficult situation and somebody else can say, hey, I'm right there with you, right? Or I've been through something similar. And having individuals who are spiritually trained or who have at least gone through something similar, and they can be just an ear that can listen to you, a shoulder for you to lean on as a means of support for you. That is something that's very profound. And I think in the hospital systems, we do have a lot more chaplains who are there of different faiths. I think that's a great thing. Even as communities, being able to support that, I think, is a wonderful thing that I think is very much needed, especially with cancer and these kind of diagnoses.
Absolutely. And I think this is the best way to transition to the next question, which is, how can faith communities and just the community in general, improve on supporting these cancer patients through their treatment and their recovery? What is the best way that we can show that support? Go ahead, Mr. Cohorst, or anybody else.
Well, a few ways is one is what we're doing right now. Is openly sharing conversations, and within faith communities, whether it's a mosque or a synagogue or a church, is to be able to develop a community of folks who are living with cancer, who then within the faith community, the imam, the rabbi, the minister can say, hey, I know a great group of people that I'd like to introduce you to. And so then it's that you don't have to go outside of your faith community. It's right there with you. And it is. I mean, like when we did the statistics, and you read the statistics. So the more that we can say to folks, part of what God calls us to do is to give back, is to share the blessings that we have had in life. And we get blessings going through cancer. When we do a cancer volunteer training for CanCare, at the end of the first day, we ask a question. It usually knocks the socks off of people. We ask them to think, before we come back next time, what's the blessing that cancer gave you? What's the gift, And then the next time we gather in a circle and we go and share it, the gifts. And there's this just kind of awakening that, oh, there is meaning, there's purpose, there's these gifts. Great. That's part of our healing, but it's not for us alone. It's for us to share, because that's what engenders hope. That's what engenders the development of faith. And it's really how we glorify God, in my opinion.
Absolutely, absolutely. Dr. Hamid, do you want to add anything to that?
I mean, in our community in Houston, we already have some volunteers who can go and visit on people. One of the programs we're doing at Wasat actually is collaborating with the Institute for Spirituality and Health, is to develop a training program for pastoral care for laymen, actually.
Wow.
So they can be properly trained, understand, the sensitivities of a patient with cancer, the medical system. So when they're going through that process, they know they do it properly. And that is coming very soon, actually. So having these visitations in a frequent basis from these volunteers is very important. And sharing a network actually of people who can do that, whether it's in the Muslim faith or outside the Muslim faith. It's very important, because we're here to support one another. And I can tell you that no one can do this job on their own, and any help that we can get is appreciated, truly, because the mission is overwhelming, and we cannot get enough volunteers to do that. But I really wanted to highlight this program we're doing, and hopefully we'll get the support and collaboration from all the communities here. And that's, by the way, it is not only Muslim faith-based, it's across the board, all denominations who are willing to participate.
Wow.
I think you're on mute, Imam. There we go.
Still can't hear you. Anyway, so I mean, those are really, really great points. I mean, I think one thing that definitely got from that conversation was, having that conversation with the community about, with cancer treatment and the recovery for it. I think there's another, like what Imam Mahad actually mentioned, it's just a completely different conversation about, when people who talk about their similar experiences with it, having a conversation with people who have gone through the same thing, like Imam Mahad said, when you talk to someone who is going through something that you have gone through yourself, I mean, that conversation just easy, rather than just talking to someone and they're like saying, oh, are you okay and stuff, because they don't know what you're going through because they've never experienced it, so having that, that support and that resources to connect with people who have gone through the same thing, I think that's an astounding way to have that conversation and share and get the support that a lot of cancer patients want. I mean, Imam, do you want to add anything to that? Oh, I still can't hear you.
Sorry.
No worries. I mean, that were all the questions that we had today. I mean, definitely a great conversation that we had to. I mean, it was definitely eye-opening, and we shed light on a topic that I think a lot of people need to know about. Realizing that cancer is actually very, very common in today's world. With the statistics that we read, knowing that even if you don't have it, someone that might have it, and be able to create that support system that we need with CanCare and in the Institute of Health that Dr. Hamid was talking about. So I think shedding light showed that there are resources out there, and being able to connect with faith communities to give them the resource they need to help and support those cancer patients. My name is Sufyan Farouk, and I work with Mesa Institute managing their programs. Today, we had the opportunity to shed light on that subject and showing ways to give support to cancer patients. And we had a great panelist, Mr. Neil Cole-Horst, who is the CEO of CanCare in Atlanta, Imam Mad, who's the founder of Sohba Institute, and Dr. Hamid, who is the founder of Wasat Institute. So thank you so much for joining us today, and God bless you all. Assalamu alaikum wa rahmatullah.
God bless you. Thank you so much.
Thanks, everyone.
Bye.